is Chris, and along with Lynn and Arlene, today we are going to do the demonstration for adult female and male peri-care.
So for this demonstration, we are going to be using several different supplies. We are going to be using a washing basin for our water, disposable clean gloves, cloths, towels for drying, large towel for drying as well, but also to keep our patient warm, and a blanket to keep our patient warm for after. Another supply we will be using will be our peri-care washing solution, which is per agency policy. The first thing that we're going to do is fill our basin with warm water. The temperature of the water is as per agency policy, but it is typically between 38 and 42 degrees Celsius. You can measure the temperature if you don't have a thermometer with your wrist. To check the temperature of the water with your wrist, but also have your patient check it with their fingers when you get to their bedside.
Once in my patient's room, I will ensure that I do all of my safety checks and make sure that I provide privacy for my patient. I will then raise my patient to my working height and ensure that they are in a comfortable position. I will help my patient assume the dorsal recumbent position for my female perineal care. I will also make sure that the patient, that I introduce myself to the patient. I'm going to take this blanket here and I'm going to place it over the patient to make sure that my patient stays warm during the procedure. I am then going to take my large towel and expose my patient's area here and place the towel underneath my patient's hips. Would you mind lifting up? Thank you. I will also take another towel and ensure that my patient's privacy is maintained while I'm not cleansing their area. Before starting the procedure, I will get my patient to check the water temperature one more time to make sure that it is an appropriate temperature for them. Would you mind checking for me? Once the water temperature has been verified by the patient, I will do my hand hygiene and apply my clean gloves. Once my clean gloves are on, I will ask my patient if they're okay for me to proceed. Are you all right if I do your perineal care now? Yes. Thank you, Mrs. Smith. So I will take a look and see how much incontinence there has been in the perineal area. And then I will take my cloth and dip it into the water. As I fully saturate my cloth and just let it soak for a minute here, I'm going to add my peri-wash to the basin. Just about 3 squirts to 4 should do. With my cloth, I'm going to make a mitt, spread my fingers, wrap it around all of my fingers, take the long part and tuck it into my palm. This will ensure that I have multiple surfaces to work off of, not contaminating any of the surfaces, and it stays in place nice. Once I have my mitt in place, I am then going to let the patient know, Mrs. Smith, I'm just going to start cleansing now. I'm going to lift the towel, and the first area I'm going to cleanse is going to be the mons pubis. So with one area of my cloth, I will cleanse the mons pubis. And then with the other surfaces, I'm going to cleanse the labia majora. From cleanest to dirtiest, the urethral meatus down to the anus area. And then I'm going to cover my patient and just pat dry while I rinse my cloth. Depending again on how much urinary incontinence as well as any fecal matter present would dictate if I need to change my cloth at all. There was no fecal matter present, so I am able to continue with this cloth here. Again, once rinsed, I'm just going to form that mitt again, tucking it in, and then I will continue with the perineal care here. So again, I'm just going to expose the area, and with my non-dominant hand, I'm going to spread the labia majora so that I can clean the labia minora and the urethral meatus. So non-dominant hand spreading and taking my cloth, again changing with each swipe. I'm going to do one labia minora, other side, other labia minora, and then with one side down from the urethral meatus cleanest down to the anus dirtiest.
As Chris is patting dry her patient, the J-swipe technique that she just used is a type of technique that we nurses use to clean and remove bowel incontinence from the patient's skin to maintain skin integrity.
Once the urethral meatus has been cleansed all the way down to the anus, now we can cleanse the buttocks. Now again, depending on how much fecal matter is present will also dictate if you change your water throughout your procedure. If there has been fecal matter, then you would need to change the water before you cleanse the urethral meatus. This is so that we do not contaminate and provide any bacteria into the urinary tract, which it can cause urinary tract infections. So I didn't have any fecal matter present, so now what I'm going to do is I'm just going to cleanse my patient's buttocks. So what I'm going to do is I'm going to have the patient roll towards me here. Would you mind helping me, Mrs. Smith? Perfect. And what I'm going to do is I'm going to, with one side of my cloth, I'm just going to cleanse my patient's buttocks. There, one. Roll them back over. Make sure that it's patted dry. And then what I'm going to have you do, Mrs. Smith, is I'm just going to have you roll over and grab onto that side rail there. Perfect. Like this. With another side of my cloth, I am going to cleanse the other butt cheek and pat dry.
While Chris is cleansing her patient and patting her patient dry, she is also making sure to check skin integrity, as this is a perfect opportunity to do so.
Once the procedure is and my patient is nice and clean and dry, I am going to remove my gloves dirty to dirty, clean to clean, and I will throw these into the garbage. And then I'm going to perform hand hygiene.
So that was about the female peri-wash. So I'm doing the male peri-wash. I have here the new basin of water, and I got the patient tested the water and added like 1, 2, 3 to 4 spray of non-rinse solution. And now I'll do my hand washing. And my clean gloves.
So the cloth will be dipped into the water, and all of the excess water will be squeezed out of the cloth, and the mitt will be made around the hand, like so. Then we'll approach the patient and we'll let the patient know that we are going to proceed with the care if they are all right with it. They give us their permission and we proceed. We will gently grasp the penis and hold it in our hands. If the patient is uncircumcised, you will pull back gently the foreskin to reveal the urethral meatus.
If the patient has an erection, perineal care can be deferred until later.
Once you take one part of the cloth and cleansing the urethral meatus, cleanest to dirtiest, in a swipe like so. You will then take another part of the cloth and perform again the cleansing around the penis shaft. Once done, place back gently the foreskin into its resting position and pat dry while you rinse off your cloth. Once the cloth has been cleansed and excess water wrung out, then you will grab the penis, lifting it up slightly with one side of the cloth cleansing the top of the shaft, again from cleanest to dirtiest, urethral meatus to the mons pubis, and then you will clean the underside of the penis, again from the urethral meatus all the way down to the scrotum. Gently cleanse the scrotum, making sure to wash underlying skin folds. Remember to rinse and dry thoroughly but gently. Pressure on scrotal tissue can be painful to the patient. Secretions collect between the skin folds. And again, depending on how much fecal matter is present, would dictate if you need to change your cloth or get a new basin full of water during the procedure. Once the cloth has been rinsed out and then again folded, you will then cleanse the buttocks area of the patient. Get the patient to roll over away from you, holding the bed railing farthest from you. Assist them if necessary. Take one side of the cloth and cleanse the buttocks, and have the patient roll back flat and then pat dry. You will then have the patient roll towards you, grasping the railing closest to you or holding onto your shoulder if necessary. Taking the back side of your cloth, wiping the other buttocks clean, placing the patient down, back down on their back, and then patting dry. Once the perineal care has been complete and any barrier creams have been applied, you can then go ahead and clean up. If there was a lot of bowel incontinence on the towel, then you can go ahead and apply clean gloves to maintain the cleanliness of you as you're cleaning up your towels. I'm gonna wash my hands. Take the towel. Mr. Smith, can you go ahead and lift up your hips for me? Perfect. Take that towel and putting it into the laundry hamper. Then taking the blanket and make sure that we're covering our patient, and we can go ahead and remove all of the blankets and towels that were used for care. Always maintaining patient privacy. Into the laundry bin. We then go ahead and make sure that our patient is in a comfortable position and providing the call bell for them. We will then make sure that we lower the bed into the lowest position. Once the bed is in its lowest position, we will go ahead and clean up all of the supplies that we had used. We will put any of the cloths and towels that we used into the laundry bin, and we will dispose the water as per agency policy.
It is imperative to remember that when performing perineal care on a patient, to maintain your own professional integrity, as perineal care is a very vulnerable procedure. Thank you so much for taking the time to watch our demonstration on male and female perineal care. I hope that I was able to answer any questions that you have regarding the procedure, and good luck in your future nursing careers.